Caroline, I'm going to be your nurse today. I'll perform hand hygiene. Can you give me your name and your date of birth?
Shelly Sumner, 5/20/71.
Okay. And can you tell me where you are?
In the hospital.
And what day is it?
It's Tuesday.
And who's our president?
Donald Trump.
Okay, alert and oriented ×3. And now we'll begin to check her vital signs. I'm going to start with your heart rate. Heart rate 72 within normal limits. I'm going to take your temperature. And while taking your temperature, I'm going to watch her respirations. Respirations within normal limits, 12 to 20. Temperature within normal limits. Are you in any pain today?
No.
I'll note that there's no precautions, so she's on standard precautions, that she is not a fall risk. Her activity level is up into the bedside. Okay, I'm gonna see that her face is symmetrical, her ears are in line. Her Glasgow Coma scale I would check because she was oriented to sound when I walked in the room. I'm gonna check your eyes. Can you follow my pen light? Checking her cranial nerves. Her blink to threat is intact. Can you puff out your cheeks for me? Stick out your tongue. Yes, so checking cranial nerves all intact. I'm going to begin by listening. Oh wait, I need to check if your pupils are reactive. Now look at me. Pupils are equal, round, reactive, and react to light. And now I'm going to listen to your heart. I'm going to list at all 5 points, the apical, the pulmonic, listening at Erb's point, mitral, or tricuspid, and mitral. Here at S1 and at S2, there's no JVD present. Heart sounds are strong. Can you grip my hands? Strong grips. Her cap refill is less than 3 seconds. Checking her pulses. Equal and bilateral, checking pedal pulses. Equal and bilateral, no edema noted. Can you push my hands and pull them back? Can you bend your knees up and back down? Range of motion in the extremities are strong. Can you touch my hands? Range of motion is great. Okay, now skin, it's warm to touch. There's no balloonness noted. Okay, now I'm going to listen to your lungs. Deep breath. Okay, can you lean forward and let me listen to your back? Okay, her breath sounds are equal and bilateral, no adventitious breath sounds, no coarse crackles or any of that. Her breathing is not labored, her O2 sat, it would be checked. We would then check her blood pressure, which would be in the normal range. Then, along with her lungs, she's on room air. So there's her method of breathing is just room air. And then I would move to her stomach to inspect it. And then palpate it. Is there any tenderness? And I should have auscultated before I palpated, listening for bowel sounds present in all 4 quadrants. There are bowel sounds present in all 4 quadrants, and then I will percuss. Okay, when was your last bowel movement?
This morning.
Okay, was it normal, firm, or liquidy?
Normal.
Okay. Would you say that when is your urinating normal, or would it be painful or
Normal.
normal? Have you noted any itching or burning?
No.
Okay. Have you had any problem with incontinence?
No.
All right. And she is her method of using the restroom is getting up to the bedside commode. Her activity level is with assistance, as tolerated. Okay, so then we're going to go down, and I would check her deep tendon reflexes with my little tool that I don't have. Okay, once again, no edema noted. If she had a wound, I would check the incision site. I would note any redness, any edema, any pain, and then I'm going to check her, any draining or any of that. I'm going to check her IV site, make sure it's not infiltrated, make sure there's no pain or redness around that. Do you have any allergies?
No.
Okay. And for safety precautions, we would make sure that bed rails were up, that she was in the lowest position, she was locked, that her call light was in reach. And I would make sure that she was in no pain, and then I would address it if she was and tell her I'll be back in a little bit to check on her. You need anything?